right, welcome everybody. Delighted to have all you folks here tonight. My name is Tal Lee, and we'll be talking about secrets of USMLE, the pathology editions from USMLE-Rx here, and first aid. So again, welcome. I am an assistant clinical professor of allergy immunology at the University of Louisville, but you folks tend to know me better as the series editor for first aid for the USMLE Step 1, Step 2, Step 2 CS, Step 2 CK, Step 3, and so forth, as well as the USMLE-Rx and Scholar-Rx test bank and Rx bricks and other related resources. We've got a special presenter today, as well as a wonderful group of panelists. So I want to get in there and get them introduced right away. So Dan, would you like to introduce yourself?
Yeah, so hey, Dan Griffin here. Currently a Pulm CC fellow at UMKC in Kansas City, Missouri. Been with First Aid a few years now, and just really excited about kind of walking through some questions and working them together and hopefully giving you some tips and tricks along the way.
Great, fantastic. We also have Sean Nanji. Sean, please introduce yourself.
Hey everybody, Sean Nanji here. Looking forward to the webinar. Dr. Griffin and Dr. Lee always do a great job. Students find it helpful, and I'll be here to answer your questions as they come up.
Fantastic. Mark Heslin.
Hi, I'm Mark Heslin, third year medicine at Cooper Medical School in Camden, and hoping to be applying for internal medicine next year.
Great, fantastic. And then what project are you working on so that people know?
The Scholar-Rx tutor initiative.
Great, fantastic. So you'll hear more about Rx Coach later on, our tutoring initiative. And then last but not least, Christine Lomagen.
Hi everyone, my name is Christine. I am an assistant professor of pathology at Lake Erie College of Osteopathic Medicine in Erie, Pennsylvania, and I am one of the authors for the RX Express videos. So let me know if you have any questions.
Fantastic. And so I suspect we will have plenty of pathology questions tonight, given that this is a path edition. And as you can see here, we are going to talk about how to dissect any question on test day. Using some of the techniques that we advise on in our RX Coach system. All right, so let's get going here. So what we'll be doing is we just went through the introductions. We'll be talking about learning and using our RX bricks, the question types, the anatomy of a board style questions, what you need to know how to dissect questions. Then we'll actually kind of do several question dissections. That'll be the bulk of the discussion this evening, and then we'll wrap it up with some dissection tips, some study tips. There is going to be a special raffle at the very end for those who are there, where you can get a special package that will include our RX bricks and USMLE-Rx 360, which includes our question banks, our videos, and digital flashcards, as well as special offer. And then we'll also open it up for some Q&A. So while Sean and Christine and Mark will be answering questions, individually and over the next hour or so. They'll also identify themes, broad themes that you obviously want to hear about, and we'll try to discuss a little bit of that at the end, time permitting. All right, so what I'm going to show you is actually is one of a brand new resource, really exciting. In fact, I'm going to actually while we have the slides of the materials, I actually would prefer to see if we can actually show it in their full living glory on the website. So this is our brand new resource called RX Bricks. It's a wonderful primary learning and curricular resource that you can use in medical school, or you can use if you've graduated from medical school and you still need a refresher, especially if you're taking the Step 1. It goes great with your curriculum. It goes great with your studying, and it could be a nice way of broadly preparing before you get into USMLE Step 1 specifically preparation. As you can see here, we have hundreds of modules, what we call bricks, because they're meant to be interconnectable and stackable in a way, because they're considered foundational learning units. And you can see that we already have 10 collections of bricks that are available from in various areas like cardiovascular and general pathology, which we're going to dive into, respiratory and so forth. And we have some other systems that will be coming out in the next 4 to 5 months as well too. So we're busy making bricks, and many students and graduates have actually been very busy using the bricks. And so the brick that we're going to be focusing on tonight, actually has to do with tissue regeneration. So we're going to actually go into this one, so this will, this is something that you can, sign up for a free trial, so you can take a look at these bricks, as I mentioned, the focus here is tissue repair, and what you see here is, we provide the learning objectives at the very beginning. There's 4 learning objectives. We're going to focus on the 3rd one here, which is describe the main steps involved in tissue regeneration. So we're actually skip to that here, and so you can see there's a navigation that you can do here, and you can just go to, what are the steps in tissue repair? Click there, and there you have it. We are there, and so I'm gonna, basically, walk you through this. So as you can clearly see here, when they start talking about it, there are the steps of tissue regeneration, which includes acute inflammation, proliferation, and maturation. So so we'll start with acute inflammation here, and I will go ahead and walk you through this section. So we've examined the determinants of tissue repair and factors involved in cell signaling. Now it's time to bring it all together and discuss the steps involved in tissue repair. So number 1, acute inflammation. So on tissue injury, inflammation begins. Exposed collagen activates the coagulation cascades, initiates the formation of a blood clot and releasing chemokines from the damaged endothelial cell. A blood clot stops the flow of blood, aka hemostasis, preventing further entry of bacteria and providing scaffolding for the attachment of incoming immune cells. So you can read on. The release of chemokines attract neutrophils, which exit blood vessels and attach to scaffolding laid down by the platelets and damaged tissue. The neutrophils break down debris, defend against bacterial infection, and release chemical signals that enhance the migration of other immune cells to the injury site. Inflammation and associated chemicals signaling are an important part of the tissue repair process that persists until the wound is successfully healed. So great here. So that's our first step, acute inflammation. Now, if you want to, you think we're going a little fast, you'll be able to review this entire recording on our YouTube channel. So now we're going to go next, which is proliferation here. So after blood clotting and the neutrophil invasion occurs, damaged tissue begins the healing process by forming granulation tissue, a soft pink granular appearing substance that consists of fibroblasts and blood vessels in a loose extracellular matrix. We can think of granulation tissue as quote unquote wound tape, a preliminary scaffolding that eventually has to be replaced by something stronger. This is the point at which growth factors come into play. Macrophages, the conductors of the wound repair orchestra, are critical to the development of granulation tissue. They release growth factors that stimulate fibroblast proliferation, new blood vessel growth, and the remodeling of the extracellular matrix. All right, so that is the second step so far. We've covered acute inflammation, now proliferation. And then we're gonna, move on to maturation. So be sure to pay attention to the role collagen plays, because it'll come in handy as we, do some of the questions. Hint, hint. All right, so in maturation, you can see here that we talk about over time as it talks about granulation tissue maturing. As fibroblasts continue to lay down the collagen, the initial disorganized and fragile network of collagen fibers begin to form a stronger, more intentional structure. Its tensile strength is augmented by the progressive cross-linking of collagen fibers that begin during the next phase of wound repair and involves remodeling. The relatively delicate type 3 collagen deposited in the early stages of healing by fibroblasts is digested and replaced with stronger type 1 collagen. Depending on the size of the wound, specialized contractile cells called myofibroblasts appear. These cells help pull the wound edges together to facilitate repair of the epithelium, through a process known as wound contracture. As this process is repeated and more collagen is synthesized, the tissue thickens and scars form. A scar is a strong, pale collagen bridge between the edges of the damaged tissue. So remember, scar formation occurs when regeneration is no longer possible. And we tend to think of scars as hardened tissue, but scar tissue has only 70–80% of the strength of the original tissue. So again, we've covered this this learning objective with regards to tissue regeneration. And you notice that when you get to the end of this section, there's actually a built-in flashcard. So what type of collagen do fibroblasts secrete in the proliferation granulation phase and wound healing? So you might have saw the answer go by. Give you a second, and then you can flip the answer. And hold on, it doesn't want to flip for whatever reason here. I don't know if my oh yeah, I think my brick timed out. So let's go back to it. So when you go to it, when you flip it, you can see here type 3 collagen. So you read about it a little earlier when we talked about what it did in the early phase. As you see, as you go through it, it continues, talks about scar formation and side effects, and you see images, and we have diagrams that you can zoom into, and so forth, tables, additional flashcards, a high yield summary, and you can see, the high yield summary, talks about some of the things that we covered in that, with that, learning objective here, right? So fibroblasts, and the type 3 collagen that was just discussed just a couple of moments ago. And then there are practice questions that you can do, all right? And then where you can get the explanation, and then you can go deeper, into additional resources, including first aid. So if you wanted to, you can actually jump into first aid and further study first aid. But we'll go back since we don't have time. And you notice that we also connect you and curate all the resources from Rx 360, not just first aid, but the flash facts and the videos and the QMAX questions. And you notice that we give you an estimated time to do all this, since you want to budget some of this. So that's a simple preview of what a brick can be used for, and then how it can lead you to QMAX questions. And in fact, we will actually do some of these QMAX questions. So with that, I'm going to head back here and hand it off to Dan.
All right, so before we get kind of started working on a few questions, let's talk about kind of how to dissect questions, as well as then how to approach questions. So first thing we need to know is that each question is written with a particular objective in mind. This just means that someone sat down and said, hey, I want to write a question on tissue repair, and they wanted to ask, how can I test the student or whoever's taking the test on how to approach that question? What is the learning objective that I want them to obtain? Whether it be the type of collagen that is defective, or the type of collagen that is used, or the type of collagen that is changed out, like when you're going from the type 3 to type 1, and kind of the later stages of wounding. So with all that, you need to know that the information that they're providing you there is there for a reason, and that they're not really trying to trick you. Often we think exam writers are trying to trick you, and the questions are meant to be tricky. They are meant to be difficult. We are trying to become physicians, and it's meant to be hard. It's not supposed to be easy, but it is not meant to trick you. Yeah, that's not something you should kind of tote into the exam or tote into question working. Is that, oh, they're doing this to try to trick me? No, it's just to try to help delineate on one point from another point. So that kind of gets me through the information's there for a reason. And then the last thing here is that the questions are written with a particular anatomy. And we're going to talk a good bit about the anatomy of a USMLE style question, and we'll hop into that right now. All right, so the general anatomy of a question consists of a stem, a lead-in, and then a key and distractors. The stem itself is basically the question itself. It's the big block of verbiage that's kind of up there at the top. The lead-in is the physical question that sits before the answers. The key is the correct answer, and the distractors are the incorrect answers. And if you advance to the next slide, we can see the color-coded version to kind of help us all tie that together. So there we go. So the stem here is in yellow, and if you're colorblind, I do apologize. Our lead-in, or once again, the question itself, is in green, and we have our distractors. And when I say distractors here, I just mean the wrong answers are in kind of our bluish color, and then our key or our correct answers in our red. So what do we need to know about all this? So the stem, or the body or paragraph of the question, it usually starts with a patient of some age presenting to a particular location. And here we can see an example, and it says we have a 23-year-old male that's presenting to the emergency department with abdominal pain. The location is somewhat important here. Remember, if you're presenting to the emergency department, it's probably going to be a different complaint than if you're presenting to, maybe an office visit, where you might come in complaining of cough and sore throat to your primary care physician, while you might come into the emergency department after a motor vehicle accident, something like that. After that, the question is going to give you a little bit more information, maybe a little bit more past medical history, past surgical history, a little bit more HPI, maybe a social history or a med list. And then from there, they're going to move into, usually vital signs and physical exam. And then this will sometimes be followed, kind of plus or minus here, with some labs, diagnostic tests. And remember, your diagnostic tests can be anything from chest x-rays to echoes to CT findings. And then all of that will finally lead into the lead-in, or the question itself, which we can see here. And our question here is, which of the following is the most likely defect in this patient's disease process? Now, the thing you need to know about the lead-in is that it can vary drastically from one question to the next, and that the stem can stay the same while the lead-in can change, and therefore the answers can change. And you can get a completely different set of answers and questions, all based off the same stem. So a few examples of some common lead-ins are, what is the most likely diagnosis? Or what is the best initial diagnostic test? What is the best initial treatment, or the most accurate diagnostic test? Sometimes they ask you what the best next step in management is, which could be a diagnostic test or a treatment. So it kind of covers both answer choices or answer options there. You might get a mechanism of action question. You might get an adverse effect question. So just kind of knowing that each stem is kind of the body or the information that they're trying to present, and the lead-in can change, and that you might need to know a bunch of the common lead-ins so that you could apply those lead-ins to different stems so that you could get many more questions right. That's one easy way to turn one question into 3 and 4 and maybe even 5 different questions. So after that, you have the answer choices, and once again, you have the key, which is the correct answer, the incorrect answers, which are kind of termed the distractor. So for this question itself, it's presenting a patient that comes to once again to the emergency department with extreme abdominal pain. They also talk about some rebound tenderness, and rebound tenderness is a sign of peritonitis or inflammation of your peritoneum. And this can happen with intestinal perforation. And actually in our stem here, it actually confirms that a little bit later on, if you keep reading, that a CT scan of the abdomen showed that he had free fluid as well as air. So that would be consistent with an intestinal perforation. So if you read also in there, he has like translucent skin and some varicosities, and all this other kind of information. And then he's coming in with this ruptured abdomen with acute abdominal pain, and then they're finally asking us, what is the defect? So for this question, this would be what we call a two-step question. First, you have to come up with what is the diagnosis, and then from the diagnosis, you need to come up with what the defect or the pathophys is behind the diagnosis. So our diagnosis here would be Ehlers-Danlos syndrome, and it would be due to a type 3 collagen defect. And these type 3 collagen defects can lead to vascular as well as intestinal rupture. So you can get like abdominal aortic aneurysms that rupture, or thoracic aneurysms that rupture, stuff like that. All right, so now just to kind of further drive home that anatomy point.
Just real quick, if I can just jump in, I should mention that Sean and Christine and Mark can help answer your questions. So if you're on a PC, there's a question panel that should be on the right side, PC or Mac, that allows you to ask questions. If you're on an iPad or Android device, I believe that there's a button at the top that will allow you to ask questions, and then they'll try to get you guys answers, during this session. So sorry about that. I'll move on to the next slide.
All right, so back kind of to further talk about just the kind of anatomy or setup of a question. I really want to go through how the stem or the paragraph part of each question is kind of set up. And it's set up pretty classically for most questions. Now, there's always your stats questions or your math questions that may be set up a little bit different, or your kind of research-oriented questions that may be set up a little bit different. But for the majority of questions, and this holds true for all levels of the USMLE, level 1, level 2, or step 1, step 2, and step 3, they're all pretty much set up the same. And it follows a pattern that we have laid out here. So we have a patient of some age presenting to some location. So once again, and this might be the most important information in the question. The demographics of disease usually hold pretty true for exams. In real life, we need to make sure we kind of break down those internal biases when we're seeing and treating patients. But for board exams, Different demographics present with different diseases for different reasons, and they usually hold true. Now, after the patient of some age presenting to some location, they usually present with some complaint, usually of some duration with some associated symptoms. So your duration can be anywhere from hours to weeks to days to months, and that's going to give you, your chronicity, which is very important in kind of, forming your differential. Is it chest pain that's been there for 6 months and, it happened after you picked up a heavy something at your house, or is it acute substernal chest pain that's associated with nausea and vomiting? Those type of things. After that, you're going to get a little bit more HPI, as well as maybe some past medical, past surgical, some social history, or even a med list. Now, all of this may or may not be there, but this is kind of the order that it would follow if it was going to be there. After this, they're going to usually run into like your vital signs, followed by your physical exam, and then you're going to get your labs, your imaging, your diagnostic test, and then you're going to see your next part, which will be just the lead-in or the question. So why might all this be important? The reason we're kind of talking about how it's set up is just the fact that if you're to work a question and you're like, hey, I think the really key point here to differentiate choice B from choice C is going to be in the physical exam. You would know just to look into your stem, find your vital signs, and right after that, there's going to be your physical exam. So if you're able to do that, you're able to quickly triage where that information would be, look into the stem, say, oh, they said, no rails. I'm not going to pick CHF. I'm going to pick, COPD, something like that. Okay, and here's our last kind of example of this question anatomy, which is just, and this is just kind of, once again, drive home this point. This is a question that we're going to see later. I actually didn't doctor up or reword or rearrange anything in this question. I just want to kind of show you how questions are set up in a particular way, and it follows a standard order. So first off, you'll just kind of click twice. All right, we're going to see a patient of an age presenting to a location. So that's going to be kind of the setup for the stem. And here we have a 28-year-old man that is schedules an urgent visit with a physician. So we have an urgent care visit with a physician. All right, and if you click 2 more times, he's going to report some complaint of something for a duration and maybe some associated symptoms. So here, after he's presenting to his urgent care physician because his urine has been darker and lower in volume than normal, he also reports fevers and headaches and cough that does not improve with time. So they didn't give us a specific duration, but we do get a duration, we get some associated symptoms, and we get a complaint. If you'll click twice again. All right, so now they're going to give us maybe a little bit of HPI, past medical, past surgical, social, our med list. And here we go. So he mentions that he's recently been producing red tinged sputum, which that's kind of another associated finding here. He claims that he's been healthy his whole life. Unsure what wrong, since this has all kind of occurred suddenly. So it's a little bit more HPI here. They didn't give us a med list. This guy's 28, maybe didn't take any meds. Didn't give us really a social history, anything like that. But you can see how it followed this order. So you click 2 more times. So next we're gonna have our vital signs, and here we go. Our vital signs are our temperature of 101.5, heart rate 88, blood pressure 132/80, respiratory rate 16. So he's got a fever. Everything else kind of looks okay. Click 2 more times. Next, we're going to get in our physical exam findings. When we look at our physical exam, our cardiac exam shows a normal S1 and S2 free of murmurs, rubs, or gallops. Pulmonary auscultation reveals diffuse crackles. Urinalysis and BMP are ordered and reveal the following. So if we click 2 more times, we're going to get our labs, and here are our labs. So our labs here, we got our BUN. You can see them. I don't need to point them all out to you. The thing I'll point out is that they have some red blood cells. And then our last, click twice, as our diagnostic findings. And for this one, it's kind of a part of the labs, but I felt like it was more of a diagnostic test as opposed to just standard labs that you order. But your ANA or your ANCA, anti-neutrophilic cytoplasmic antibody, is negative. So ANCA, sorry about that. I said ANA originally. ANA is incorrect. This would be your ANCA, ANCA. So ANCA is negative. So from here, they're going to ask us what the target pathologic process is, and then we pick our answer. But anyway, just to show you, this is how these questions are set up, and this is kind of the anatomy behind the question. And from there, we kind of want to now talk about different approaches to questions, or how to approach questions. And you can, there we go, good. So there's several different ways to approach questions, and the big thing I kind of want to point out is that it's not so important that you choose one particular way, but just that you have a way that comes, that comes natural for you. The thing that I'll point out here is that we've come up with this method. We think this method works. It works for our students in our little coaching kind of tutoring session that we have, and it's great. So this is the method that we kind of suggest. So the 5-step method here, basically we're gonna just kind of walk through this 5-step method from step 1 to step 5. And our first step here is we state that to cover up the answers. And when you cover up the answers, you can use your hand. You can just not look. Use a Post-it. Drag your screen down so that you can't see the answers at the bottom. But what we're trying to do here is we want you to read the last sentence or the question itself or the lead-in first. And we don't want the answers themselves to kind of taint your thought process. We just want you to be able to think about the lead-in, maybe highlight some keywords in it, kind of realize what the question's asking you so you don't have to reread it later. And you can kind of focus on, hey, this question's really getting into a diagnosis or really getting into a mechanism of action. So after you've done kind of step 1 there, which is cover up answers, read the question, we'll kind of move into step 2. And step 2, we want to determine how many steps this question is going to require. So is this a single step question, or is it a 2-step question, or a 3-step question? So remember earlier we kind of talked about a 2-step question, which we had to come up with a diagnosis, and then we had to define or find the pathophysiologic problem with that diagnosis. So maybe a step 1 question or 1-step question would be something like, what is just the diagnosis? So they ask for the diagnosis. That's kind of 1-step reasoning. You're able to read the stem. Say, hey, the diagnosis here is rheumatoid arthritis. So that's as far as it's going to get. A 2-step again would be maybe identifying a treatment. So they don't tell you the diagnosis is rheumatoid arthritis, but they ask you, how do you want to treat it? And your answer would be methotrexate. So then they might say, what is the mechanism of action of the medication used to treat this, disease? That would be a 3-step. First we had to know that it's, rheumatoid arthritis is our diagnosis. Second, we had to know that we were going to treat it with methotrexate. And then third, we needed to know, the mechanism of action or the adverse effect to methotrexate. So that would be kind of determining how many steps. And that would be step 2 of our 5-step process here. Now on to step 3. Here we want to just read the stem itself just from beginning to end, and we want to try to highlight the key points. Maybe it's a phrase or a word or a particular lab or an image that jumps out at you and says, hey, this is definitely something that I need to know for later. From there, we're going to move on to step 4. Now this is after that you've read the question, you've done everything, you've kind of done the legwork here. What we want you to do is just basically try to think of the correct answer. So basically you still have your answer choices covered up, and we want you to you read that final sentence again and say, hey, they're looking for a diagnosis. Well, I think this question is talking about the diagnosis of maybe we have abdominal aortic aneurysm. So for our diagnosis of abdominal aortic aneurysm, that's why this is the reason I think that this is the right answer. This is kind of the info behind it, why I'm choosing this answer. And while this process might seem like it takes a little while, what we'll tell you is this: if you practice it, hone it over some time, you will get faster. And that goes for anything that you do repetitively. Kind of goes for like reading EKGs and reading chest X-rays. You want to make sure that you have a process, and that you do use that same process over and over and over till you get really good at that process, so that you can move through that process quickly. So now moving on to our 5th step. Now once again we've covered all the we've covered the question, we've covered the kind of thought process behind what we think our answer is going to be, and here we're going to basically uncover our answers and pick our answer. If we did it all right, hopefully one answer just jumps out at you, and that's the right answer, the answer that you're going to pick, and then you're going to move on. And one of the focus here should be the actual moving on process. Making sure that you don't get hung up after you go, hey, I thought this was abdominal aortic aneurysm. I uncovered my answer choices. There was abdominal aortic aneurysm. I'm gonna move quickly. From this process, though, we do want you to look at each answer choice, and so that you don't get too too jumpy and advance too quick. We want you to actually look at all the answer choices from the bottom up, and we think this just kind of prevents you from moving too fast through your answer choices. You're going to read each answer choice, kind of make sure you apply a mental thought process to it. Then once again, select your answer and hopefully move on. If you haven't been able to select the answer at this point, use that process of elimination, where you're just going to kind of go through there and say, hey, I don't think A is right because of this. I don't think C is right because of this. That's going to leave me with B and D. I'm going to pick B because X, Y, or Z. So, all right, well, that's kind of the 5-step process there. And now we're going to use that 5-step process to work a couple questions. So let's hop right into that first question. All right. So we'll first start with our step one, which is to cover up our answers. And you can see we've done that for you. You can't see the answers. So, and now we want to read, the question itself. So which of the following is the most likely cause of this patient's disease? So here they're looking for a cause. So moving on to our step 2 of our process, how many steps do you think this question is going to require? Well, it's looking for a cause. So that's going to mean we need to figure out a diagnosis, and then we're going to have to figure out the cause of that diagnosis. So this would be a 2-step reasoning question. All right. So now we know that we're looking for a cause. We know this is going to be a 2-step reasoning question. Now let's move into step 3, which is just read the question and maybe highlight some key points along the way. So here we have an 8-year-old boy that's brought to the physician because he has severe pain in his left foot. He was running on the playground when he tripped and fell, and he's now unable to bear weight on his left foot immediately after the fall. His mother adds that her son has broken his arm within the past 2 years. The results of a complete blood cell count and erythrocyte sedimentation rate are normal. And then we have a picture of the child's eyes. So now that we've kind of read the question, we've highlighted some key points, and some major takeaways here are that he's 8, that he's fallen and now he can't bear weight. He's also got a history of some broken arm. And then if we get this picture of the eyes, and if we look at this picture, we realize that it's a presentation of a pretty particular condition. You don't know what that is, that's what we're here for. But if it can kind of be like a buzz image almost. You look at it and go, oh, this is what they're talking about. All right, so now time for step 4. We want to remind ourselves what the question is asking. Once again, they're looking for a cause of a condition. So once again, it's a 2-step reasoning question. So that's going to make us think of a particular diagnosis. So think of your diagnosis. What do you think your diagnosis is? Get that in mind. Now I want you to think of what do you think the cause of that diagnosis is. So this is diagnosis X, which is due to, Y. And after you've kind of come up with that, you're going to uncover your answers. And there we go. So now let's go through them real quick. So we have a mutation in the tumor suppressor RB gene. We have a defect in fibrillin synthesis. And once again, we're going to go from the bottom up. Abnormal type 4 collagen synthesis, abnormal type 3 collagen synthesis, and then abnormal type 1 collagen synthesis. So now that we've kind of gone through our whole process here, I just want you to take some time to think about it, and we're going to put up a poll for you to hopefully answer this question.
I'm going to give you guys a minute to come up with your answer, and we're going to go ahead and launch the poll here. So you should have a poll in front of you. And you should go ahead and pick an answer. So we'll wait for about 15-20 seconds. It does take a little while for all the answers to tally in. Looks like about 40% have responded. Wait a couple more seconds. All right, a couple more seconds. I'm going to try to wait till 70%. If you don't have a good answer, just go ahead and take your best guess. Just want to be able to make sure that you guys can actually provide an answer. All right, so we've got about 70% voting, so I think that's good enough. I'm going to go ahead and close the poll and share. And what you see is that the majority of folks chose answer A, abnormal type 1 collagen synthesis, and then there's a smattering for type 3 and 4, and then some of the others. So let me hide that and then get back to the presentation. And the answer is indeed A, abnormal type 1 collagen synthesis.
Great,
All right.
great.
Yeah.
So now just to kind of go through this question again, once again, we have our 8-year-old boy who's fallen and can't bear weight. So if this is a little bit more kind of a clinical statement, but you'll run into it eventually, it should immediately kind of make you think of like the audible rules. If you can't bear weight after falling and yada, 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 where you have pain, those type things. It basically makes you think that this kid's got a fracture, which, we end up, finding out that he does indeed have a fracture. And I also learned he's, broken his arm before, which is, once again, this is a little strange for a child. We have a young male that's fallen and broken his leg just when he was out playing, and then he's, basically broken his arm. That should kind of be keying you into something not being quite right. Why is our young male here having so many fractures? We go on to read that our labs are fairly normal. We get this image of our eyes, and so what do we see here? Well, what we see is blue sclera. And this is due to exposed choroid, which is due to a thin cornea. So all of this makes some sense in the setting of osteogenesis imperfecta. Now, osteogenesis imperfecta is due to a type 1 collagen defect. You get problems making skin, dentin, fascia, as well as bone, and as well as your corneas. So your corneas kind of become thin. You get this blue sclera appearance, which is due to the exposed choroid. And that's kind of the pathophys behind the eyes there. So now just to kind of go through our answer choices, and once again, we kind of want to go from the bottom up. So we have E, which is our mutation in tumor suppressor gene RB. Now this would lead to like retinoblastoma or osteosarcoma. That's not going on here. The retinoblastoma can cause some eye findings, but it's not the blue sclera of osteogenesis imperfecta. Choice D is due to a defect in fibrillin synthesis. Now this is talking about Marfan syndrome. And here we're going to usually see, tall, long-armed, long-legged, long-fingered individuals with some flexible joints. You can also see things like aortic aneurysms and some valve problems, so kind of some other heart/aneurysm problems. Our choice C, which is type 4 collagen synthesis, abnormal type 4 collagen synthesis. This would be like Alport syndrome, which is due to a defect in type 4 collagen. Here you're going to see glomerulonephritis. And anytime you read the word glomerulonephritis and you think about just bloody urine, so bloody urine, glomerulonephritis, those kind of need to go hand in hand. And this, you're also going to see some vision problems and hearing problems. So Alport's glomerulonephritis or bloody urine with some vision and hearing problems. And then we have our abnormal type 3 collagen. And again, like we said earlier, this is Ehlers-Danlos syndrome, which is usually due to causes some mild hypermobility. You get these atrophic scars, and then high risk for arterial and even intestinal rupture, kind of like our previous question where we had the intestinal rupture. And then, like I said, our correct answer here, which is osteogenesis imperfecta, which is due to an abnormal type 1 collagen synthesis. And you remember, this is the main collagen of bone. It's also seen in skin, dentin, fascia, the cornea, like we said earlier. And that's how we get this blue sclera that we talked about. So it makes sense that this would be our correct answer. All right, so I think that kind of wraps up this question. So I think we can move right on into the next one. All right, so here's our next question. We're going to go through our process again, our 5-step process. And remember, our first step is to cover up the answers and look at the question itself. So our question itself says, which of the following is this patient most likely to experience? So what is that asking? So we're asking, which of the following is the patient likely to experience? So once again, this is a, how many steps in reasoning when we move on to step 2. So once again, step 1, we cover up the answers, look at the question or the lead in. Step 2, how many steps in reasoning is this going to require? Well, this is another 2-step reasoning question. Again, we have to come up with our diagnosis, and then we have to come up with an associated finding. So, so kind of a 2-step reasoning question there. So we've gone through those 2 steps. Now we want to actually look at the question or the stem itself. So let's read that and kind of highlight some key points along the way. So here we have a 3-year-old boy that's brought in by his mother to the emergency department. Once again, we have a patient that's coming into a location with a complaint, kind of like we talked about earlier, saying his leg hurts a lot. His mother is worried that her son has broken his leg. The boy has a medical history that is significant for recurrent fractures, which have mainly occurred when he falls and he's playing with other children. So he's falling, kids fall. So he's falling and other kids are falling, but he's falling and breaking stuff. That could kind of be red flag there. On physical exam, we see some discolored teeth, despite him brushing twice daily, and an x-ray, which again, we get into kind of our lab work and our imaging stuff. An x-ray reveals a fracture of the left fibula. So now that we've read the question, we've kind of highlighted some key points. And once again, these key points, once again, the fact that he's a 3-year-old kid, he's fallen and he's got some pain. So we're suspecting a fracture. Then, it goes on to tell us that he does have a fracture. And then they also give us this kind of other information about his teeth. And it's fairly specific. Give us his teeth are discolored and he's brushing twice daily. That would be a weird question, I think, for an ER doctor to ask. That's just my personal opinion. How many times a day is your child brushing his teeth? Even though you're coming in for your bone sticking out of your leg. But anyway, needless to say, that's kind of where this question has led us. So they've given us this information for some reason. And once again, so remember that the information is there for a reason. Is not there just to trick you, not there just to make you go on a wild goose chase. So now on to step 4. So what are we thinking? What do we think our diagnosis is here again? So once again, this is a 2-step reasoning question. We need to come up with a diagnosis. So what do we think our diagnosis is? So come up with that in your mind. And then we want to think of a potential associated finding. So once again, they're not looking for the pathophys, like the reason why, like our first question, which was looking for the collagen defect. This is looking just for an associated finding. So we have our diagnosis and our associated finding. Think about those real quick. And now after you've kind of thought about them, let's uncover our answers. And we'll move from the bottom up. We have, once again, progressive hearing loss. We have hypotonia. We have future fractures from abuse. Just fractures from abuse, bowing of the legs, arachnodactyly, and then aortic aneurysms. All right, so now thinking about those answers, we'll kind of submit the poll so that you can pick one. All right, so here we can see that most of everybody's picked progressive hearing loss is the answer. Let's. All right, and is this the answer slide or the last slide?
This is the answer slide. Sorry about that. My audio was muted for a minute. My apologies.
No, you're good. You're good. So this is just the review slide. So, but the correct answer here is F, which is going to be progressive hearing loss. So once again, all those that picked progressive hearing loss, great job. So let's kind of walk through this question. Once again, it's a 2-step reasoning question. We had to come up with our diagnosis. And what does everybody think our diagnosis was here again? There you go. It's osteogenesis imperfecta. And then we had to come up with an associated finding. So again, they give us this 3-year-old kid. He's coming in with this leg pain. He's got a past medical history of some recurrent fractures. All this should be red flags. Kids shouldn't have this many fractures. Again, kind of going back to our first question. And then, they're not presenting anything to make us think abuse. Anytime you get a child with recurrent fractures or a lot of fractures, think about abuse. Usually some kind of things that they may say in a question, or wounds in different stages of healing, or some like a bucket handle fracture or a spiral fracture. These are kind of different or weird fractures that you shouldn't get, and usually are only caused by abuse type situations. But they didn't give us any of that stuff, so nothing to make us think abuse here. And then they give us this information about the discolored teeth despite brushing twice daily. Anyway, this is just an odd statement to make in the middle of a question. So in this scenario, it is likely that it's important. It would be weird to include a sentence on this and it not be something that's important. So if you weren't able to get to, hey, maybe this is osteogenesis imperfecta without the information, hopefully this was some additional information to kind of put you over the hump there, and help you realize that, hey, this is osteogenesis imperfecta. He's got the discolored teeth due to poor dentin formation, and there's no amount of brushing that can fix that. So once again, osteogenesis imperfecta due to a type 1 collagen defect. So he's going to, once again, type 1 collagen is used in the production of bone, skin, dentin, fascia, the corneas. So now that we've kind of done all that, we need to know kind of what our correct answer is and why it's progressive hearing loss. So the progressive hearing loss here seen in osteogenesis imperfecta is due to fractures and dislocations of your ear bones. And once again, this can lead to a progressive conductive hearing loss. So not sensorineural, so just conductive. Basically, the bones kind of ossify. They just stop working. You can't hear as well. So that would be why our correct answer here is progressive hearing loss. So now just to go through the other questions real quick, or the other answer choices. Hypotonia, this is seen in Menkes disease, which is due to impaired copper absorption as well as transport. You also see some brittle, kinky hair, some growth retardation. You can also see recurrent fractures here, but they didn't give us the hair findings. They didn't give us the growth retardation. And so nothing else to kind of suggest Menkes here, or the hypotonia. Fractures from abuse, once again, it'd be seen in the setting of abuse. And once again, we didn't have anything to suspect of abuse. Bowing of the legs, this would be seen in rickets, which is due to vitamin D deficiency. It's not a correct answer here. Ractodactyly, or yeah, I think I said that right. Who knows? I don't know. Long, skinny fingers. That's seen in Marfan syndrome. Not something that we're talking about here. And then aortic aneurysms, which can also be seen in Marfan's or Ehlers-Danlos, which is, again, not what's going on here. All right, so now on to our last question.
Yeah, and again, I apologize. I was muted accidentally, so I just want to apologize for anybody who was thinking about C. We ran out of space in the webinar polling system, so we had to drop one of the responses, which unfortunately was C. So I should have let you guys know ahead of time, but that was not correct anyway. All right, let's keep going.
All right, so now on for our last question. Once again, we're going to follow our kind of 5-step process here. We're going to cover up our answers and look at the question itself. So the question itself, for the lead-in states, what is the target of the pathologic process causing this patient's pulmonary symptoms? So we're looking for a target of a pathologic process causing some pulmonary symptoms. So now on to step 2, which is how many steps in reasoning does this require? So first we need to come up with a diagnosis, because we're looking for a pathologic process. So we need to come up with a diagnosis. And then after we come up with a diagnosis, we need to come up with, basically what the pathologic process is seen in that diagnosis. So again, this would be a 2-step reasoning question. So now from there, let's go into step 3 of our 5-step process, which is just to read the question and see what we think is important. So going through here, we have a 28-year-old man that schedules an urgent visit with his physician because his urine has been darker and lower in volume than normal. He reports fevers as well as some headaches that does not improve with some time. So he's got fever and headache that doesn't improve with time. He mentions that he's recently been producing some red tinted sputum and claims that he's been healthy his whole life and is unsure what went wrong since this kind of all occurred suddenly. His vital signs show a temp 100.5 or 38.6 degrees Celsius, heart rate 88, blood pressure 132/80, respiratory rate 16. His cardiac exam reveals a normal S1 and S2, free of murmurs, rapid gallops. Pulmonary auscultation reveals diffuse crackles. Urinalysis and basic metabolic panel are ordered and reveal BUN 24, serum carbon dioxide or bicarb 22. Creatinine maybe a little up for 28-year-old otherwise healthy fella, 1.1. Glucose fairly normal, 88. Serum chloride 105. Serum potassium 3.8, sodium 140. All those look good, normal. Urine protein 2+. That would be a little abnormal. You wouldn't expect a 28-year-old to have 2+ proteinuria, even though it's not super significant. You just wouldn't expect it. Another abnormality here: 6 red blood cells per high power field. Really wouldn't expect a 28-year-old guy to have blood in his urine or protein in his urine. And then now kind of looking back at that creatinine 1.1. With the BUN, maybe that is a little bit more significant. Maybe his BUN and creatinine are a little bumped. He's got a little protein, he's got a little blood in his urine. So urine sediment, we see some cast, and then our diagnostic test here, which is our anti-neutrophilic cytoplasmic antibody, or ANCA. So this would be your ANCA, ANCA, is negative. So if your ANCA is negative, that means that your C as well as P ANCA are negative. So C and P ANCA are negative. So key points here. Once again, we have a 28-year-old guy that's coming in for an urgent visit. So something kind of acute, at least acute in his mind. He's got this darker urine, the lower urine volume, so he's not making as much urine. And then he's got fever and headaches. He's got this red tinted sputum. Red tinted sputum should always kind of be a super buzzword for, something's not right in the lungs on a board exam. In real life, you can cough till you get a little bronchitis and there's a little red tinge stuff. But, and on board exams, red tinge sputum is considered serious. He's been healthy otherwise his whole life, kind of happened suddenly again, normal cardiac findings, crackles on pulmonary findings. And now this leads us to step 4. So what are we thinking? What do we think our diagnosis is here? Do we have a diagnosis? So after we get our diagnosis, what do we think our kind of pathologic process is in our kind of diagnosis? So after we get all that, let's look at our answers. Good. And then so going from the bottom up, we have type 4 collagen, we have type 2 pneumocytes, we have type 1 pneumocytes, we have type 1 collagen, and then we have surfactant. So these are our answer choices. Once again, come up with your diagnosis, look at your answers, think about your answer choices that you have available, and we will put up our poll, let you select an answer.
All right, I'm going to go ahead and launch the poll. All right, go ahead and choose an answer. Looks like about 20% of you guys have voted. We'll keep it open for about another 15, 20 seconds. Looking for at least half of you folks to choose an answer here. All right, great. We've got at least 2/3 of you folks have answered, so that's good. I'll go ahead and close the poll and share the results here. And you can see here, most of you guys chose type 4 collagen, answer E. Some of you also chose type 2 pneumocytes and type 1 pneumocytes. So let's see what the actual answer is, and it is indeed type 4 collagen. All right.
Great. I can't see the slide itself, but if we could advance to just the question again. Perfect. All right, so great. Type 4 collagen is the correct answer. So just to review this question, we have a 28-year-old guy that's coming in for some dark urine, decreased urine output, also reporting some fever, headache, and coughing up this red tinge stuff. At this point, if we're having decreased urine, we see our labs with our, basically our proteinuria, our blood in our urine, our glomerulonephritis type picture, maybe a little bit of elevated creatinine, and then the coughing up the red stuff. This should make us think of basically one of our pulmonary renal syndromes or some of our pulmonary renal syndromes. There's a lot of these, but there's basically a few classic ones that you need to remember. One of them is anti-glomerular basement membrane disease or good pasture. Another one is granulomatosis with polyangiitis or GPA. The other name for that is Wegener's or Wegener or Wegener, depending on how you want to say it. Then we have microscopic polyangiitis. And then we also have eosinophilic granulomatosis with polyangiitis or eGPA or Sturge-Strauss. Another one that can kind of slip in here is lupus. So just to kind of review those pulmonary renal syndromes, think about things that cause kidney trouble, usually a glomerulonephritis or bloody urine with some coughing up blood. We have good pastures, we have Wegener's, we have Sturge-Strauss, we have microscopic polyangiitis, and then we have some lupus. Those kind of the main causes there. So from here, once again, we learned that he's been otherwise healthy, which is pretty atypical for lupus. So lupus would kind of be out as a potential cause here. Also figure out that he has some fever, some pulmonary crackles, and a UA with the blood and the protein. They give us the ANCA or the ANCA, yeah, and it's negative. So this basically rules out what's called granulomatosis with polyangiitis or Wegener's, as well as eGPA, which is once again eosinophilic granulomatosis with polyangiitis, and then microscopic polyangiitis. So rules out all 3 of those potential causes of pulmonary renal syndromes. Once again, just to review real quick, C ANCA positive would be consistent with Wegener's or granulomatosis with polyangiitis. And it could also be PR3 positive or anti-PR3 positive. So GPA or granulomatosis with polyangiitis is going to be C ANCA positive or anti-PR3 positive. And then eosinophilic granulomatosis with polyangiitis or Sturge-Strauss, as well as microscopic polyangiitis, are going to be P ANCA positive or anti-MPO positive. So just remember to associate P ANCA and anti-MPO, and then C ANCA and anti-PR3. Those are kind of some things you need to make sure you have that just memorized. And there's lots of ways to do it. I remember that C is the 3rd letter of the alphabet. So since it's the 3rd letter of the alphabet, I go with PR3. That's just easier for me to remember. So Of these, we have our main pulmonary renal syndromes. We've essentially ruled out all the pulmonary renal syndromes that we've kind of talked about here. So the only one that we have left is anti-glomerular basement membrane disease, or good pasture. And here this is due to antibodies against type 4 collagen, which is seen in the glomerular basement membrane of the lungs as well as the kidneys, or the glomerulus. So that makes choice E our answer. So that is that. That actually wraps up that question. I think that wraps up all of our questions. So
fantastic, Dan. Thank you. All right, so let's go ahead and wrap things up here. Hope you enjoyed Dan's whirlwind question review and question dissections, and hope you saw how we applied the 5-step strategy to breaking down these questions. Just to remind you that when you're approaching the exam, keep these things in mind. Essentially there's a good reason why we spent some time in pathology. It's approximately half the exam, really. In addition to what you're seeing with the foundational concepts and physiology and so forth. As you heard Dan talk about, you want to have a solid approach that you can execute. It's just like your normal protocol for approaching all the questions. And again, we talk about our 5-step process, and that's something we can drill a little bit more in depth through our Rx coaching services. Remember that all questions have a format where you have the stem, which is the case, the lead-in, which is the actual question, and then the actual answer followed by and then which is also buried by the distractors. When you go through the steps, remember that you have to figure out how many steps each question is required, because then that allows you to break down the logic and figure out what you're looking for. In choosing your answer, recognize that there's not that much fluff in these questions. Most of the information is there for a reason, either to potentially give you the right clues to drive you towards the correct answer, or to purposefully pull you away from that and towards one of the distractor, right? And so therefore, like I said, everything is there for a purpose. In the question itself has been created to test, a specific concept, in one of the domain areas of the USMLE blueprint. All right, some general study advice. This is something that we talk a little bit about in our Path to 250 webinar. You want to plan ahead of time. You want to develop a study schedule, and you want to make sure it's something that's resilient that you can stick with. And we have plenty of these examples at our blog, firstaidteam.com. The second piece of advice is integrate and apply everything. So you notice how in these multi-step questions, Dan had to think about, okay, I have to get to the diagnosis, then I have to get to the mechanism of disease, or I have to get to the diagnosis, then the treatment, and then the mechanism of action of that treatment, right? And so it's all about the integration. It's also about linking all the concepts together. Third piece of advice, you have to do lots of questions. I was just on another discussion last night about how we learn, and something called transfer appropriate processing, which means that to do something well in real life. So if you want to do well on a multiple choice exam, you want to practice with a lot of multiple choice questions, right? And so since the USMLE is all multiple choice questions, you got to do a lot of multiple choice questions, and some of the best research out there says that we need to do at least 3,200, if not more, questions, for optimal performance on the USMLE. Number 4, don't try to overschedule. Don't try to cram too many things into your study calendar. Make sure that you take time for breaks and so forth, and to be able to catch up. We do recommend that you need to be deliberate and intentional in your planning. We talk about, in first aid, that there's a study schedule and there's a study protocol where we walk you through all the planning steps. So do take advantage of that.